Okay, so my name is Maisha Hutton. I'm the Executive Director of the Healthy Caribbean Coalition, and we're delighted that you've joined us today for this ninth annual Caribbean Alcohol Reduction Day. We're looking forward to sharing insights and thoughtful discussion on this intriguing theme of unmasking influence, regulating alcohol marketing in the Caribbean. I'd like to invite everyone to listen to opening remarks from our president, Dr. Kenneth Connell, followed by Dr. Gloria Giraldo. She's the NCD's and mental health advisor at PAHO. PAHO is a longstanding partner of the Healthy Caribbean Coalition, in particular on CARD. So Kenneth, over to you.
So thanks very much, Maisha. Good morning, good afternoon, and possibly good evening. Greetings on behalf of the Board of Directors of the Healthy Caribbean Coalition, and thank you for joining us for the 9th Annual Caribbean Alcohol Reduction Day, or CARD, under the theme Unmasking Influence, Regulating Alcohol Marketing in the Caribbean. CARD was first celebrated in 2016 as an initiative led by the HCC in partnership with the Pan American Health Organization, or PAHO, and other key partners. The aim of CARD is to sensitize civil society and the wider public about the dangers of alcohol consumption, while building support for implementation for evidence-informed alcohol policies. And over the past 9 years, CARD has focused on a number of issues, including alcohol and cancer, youth, women, COVID-19, and last year, under the leadership of HCC's Alcohol Policy Advisor, Professor Maraj, the HCC hosted its first regional conference in Trinidad, showcasing alcohol research from across the region, and many of you would have joined for that conference. This year's theme was triggered by a series of alcohol advertisements, directly and indirectly promoting alcohol consumption during Breast Cancer Month, which caused deep concern among civil society communities. And this led to a closer revealing the ubiquitous nature of alcohol marketing. Alcohol marketed everywhere, including murals adorning the corner of rum shops, the lyrics to popular calypso and crop over in my country, concerts and youth sporting events. And of course, on mobile phones, bombarding us with digital promotions across our social media feeds. I was recently stuck in traffic in a busy holiday season, pre-Independence Day in Barbados, and right in front of me was the marketing of alcohol to kids in the form of ice popsicles called boozicles. Marketing is a powerful tool used by industries to drive consumption of their products, and the alcohol industry is no exception. Alcohol marketing increases the intention to drink, levels of alcohol consumption, and it normalizes consumption as well. Deeply concerning is when this marketing is directed towards young people and women who we know are particularly vulnerable to alcohol's harm. As you know, alcohol is a leading risk factor for NCDs, and in recent years, the global public health community, led by WHO, has aligned the fundamental principle of no safe level for alcohol consumption, underpinned by the ambiguous scientific evidence linking any level of alcohol consumption with increased cancer risk. And I want to repeat that not just for the wider community, but also to remind my own fraternity. The unambiguous scientific evidence linking any level of alcohol consumption with an increase in cancer risk. However, there continues to be a lack of public health understanding and appreciation of the extent of alcohol harm, driven by a vacuum of public health policies to support reduced availability, affordability, acceptability, and attractiveness in the public health of alcohol products. Civil society is a critical actor in building awareness and demanding policy. The goal of CARD 2024, therefore, promote CARICOM-wide implementation of bans or comprehensive restrictions on alcohol advertising, sponsorship, and promotion. So we are delighted that you have joined us today. We have an excellent panel of experts, myself excluded, who will share the latest information on alcohol harm, regional and global examples of alcohol marketing, and regulatory measures to protect populations from alcohol harms. I will now hand over to the Executive Director, But before I do so, let me finish by saying to all Barbadians, happy independence as we celebrate our independence tomorrow on November 30th. As all Caribbean states celebrate our various independence and national holidays, we need to sit consciously at the table and examine the unhealthy relationship that alcohol has with Caribbean culture in a Caribbean space. Enjoy the meeting. Thank you.
Thank you, Dr. Connell. And we'll move on now to Dr. Gloria Giraldo. Gloria, over to you.
Thank you, Maisha. Good morning and greetings on behalf of the Regional Program Coordination Office of the Pan American Health Organization. I greet again Dr. Kenneth Connell, President of the Healthy Caribbean Coalition, Professor Rohan Maharaj, my WHO colleagues who are here with us, members of the academia, civil society, and all partners and all the persons that are joining us today. It is an honor to participate on the 9th edition of the Caribbean Alcohol Reduction Day, with the special focus on unmasking influence, regulating alcohol marketing in the Caribbean, which embodies our collective pursuit of promoting healthier environments that are conducive to achieving healthier lives for our Caribbean citizens, families, and communities. The Caribbean faces unique challenges in tackling alcohol-related harm, from health consequences to social and economic impacts. And the need for comprehensive strategies and collective action is paramount. And these consequences of alcohol harm are real in our own lives. My very close friend Lucy, whose life was forever changed by a person driving drunk, by a drunk driver. And the young woman who called me just about a week ago, crying, feeling that her life was slipping out of control into a spiral of despair due to alcohol. These are real consequences in people's lives. Therefore, even though it is very challenging to address the topic of that we're talking today, alcohol regulation, alcohol marketing regulation, we know that we need to continue to be bold in our collaboration, innovation, and sustained efforts towards meaningful change. Every year, we gather and we reaffirm our commitment to address the challenges posed by harmful alcohol consumption. And we acknowledge the commitment that governments to date have done, and we encourage the continued work by civil organizations, by healthcare professionals, by communities across the Caribbean in advancing policies, awareness, campaigns, and interventions aimed at reducing alcohol harm and with the view to achieving the targets outlined in the Global Alcohol Action Plan that is dated until the 2030. So we have bold goals. PAHO stands committed to supporting the Caribbean in its journey to healthier, safer, and more resilient communities through technical support to governments aimed at reducing the harmful use of alcohol and related health, social, and economic consequences. Let's embark today on this journey, and I wish us all a very, very productive webinar. Thank you very much.
Thank you, Dr. Giraldo, for those excellent opening remarks, which reminded us of the real life implications of harmful use of alcohol, the harms of alcohol consumption. I'd now like to invite our card consultant, Simone Matthews, to engage all of you through Mentimeter exercise. Simone, we're going to do this before we jump into the panel. I'm really looking forward to hearing from Simone, who's also a member of Healthy Caribbean Youth. So Simone, over to you.
Thank you, Maisha. So good morning, everyone. So if you would just scan the QR code on your screen, what this activity aims to do is to get us thinking about what we are seeing in our environments and to set the scene as we dive into the different marketing strategies throughout the webinar. So if you can scan the QR code, or the link has been added to the chat, and let us know what you guys are seeing in your respective countries. So I'll give a few seconds. The responses are slowly coming in. So we have Caribbea, Black Friday sales, Instagram, Bay advertisement aligned with Christmas celebrations with champagne. I mean, we are in the Christmas season, so definitely we'll be seeing a lot of those. Christmas ad for Bay, bringing families together, price reduction in groceries. Boozicles. I've never heard of a new term. Lots of ads for Christmas. Right. So as we can see, we can kind of get the understanding that we're all commonly exposed to these alcohol ads, specific marketing, targeting specific groups throughout the Caribbean. So as we kind of dive into the webinar, I really want us to pay attention to the ads that we're seeing and the possible effects that these marketing strategies can have on health and social well-being. So that's it. Over to you, Maisha.
Thanks very much, Simone, for that. That was really exciting to see all of the different examples of marketing that we're seeing across the region in different settings. So now we're going to go to our panel discussion, and I'm really excited that we have the panelists here today. You've already heard from Dr. Connell and Dr. Giraldo with opening remarks, but our panel today consists of Dr. Juan Tello, who's the unit head of less alcohol of the WHO. And then we have Professor Rohan Maharaj, who's with our very own alcohol policy advisor, who's been with HCC for over a decade now. And we have then Ms. Elizabeth Ruiz Cairo, who is a legal consultant at WHO. So we're going to kick off this session with Dr. Juan Tello. Juan, I'll invite you to share your slides. That's great. We can see your slides, just waiting for presentation mode.
Is that now? No, it's not. Good afternoon, good morning, everyone. I need a few seconds.
That's okay. While you're organizing that, I think we're having some chatter in here about boozicles, popsicles with alcohol. Simone was saying she'd never seen that. That's something that's quite popular here in Barbados, where we are based. Let's see if I can help on my end with the slide deck.
Yes, maybe we need to do it.
Yep, I'm going to share on my end, Juan. Just hang on 1 second.
I can see that it's not projecting.
So
let me try now. Is that now? I think it should be okay.
Is that on your? This is me. You just want to let me know. I can direct slides.
It's mine, I think, and from my side. Is that correct?
It's me sharing, actually. I can stop sharing and you can go. Oh, there we go. Perfect. Go ahead. Over to you.
So good afternoon. Thank you for the invitation. Why are we so much concerned with alcohol, or why are we concerned about drinking alcohol? And already in 1988, the EIR, the International Agency for Research on Cancer, already declared ethanol a carcinogen substance. So we have already, it has been mentioned already, this link between alcohol and cancers, and already well documented. There is new evidence that has been published recently by EIR, but importantly is the fact that the alcohol or ethanol causes damages in the DNA, and that's the reason why this is happening. Ethanol is also a psychoactive substance. It's addictive, so it creates dependency. Just to recall ourselves that intoxication from alcohol leads to alteration in physical coordination, consciousness, cognition, perception, and behaviors. You see here a couple of resources that in many slides you will see resources and the links to them so that you will be able to download and to have a lot of the material that has been produced by different institutions. If we look at our life course, so alcohol is very much influencing injuries at the earliest stages, let's say between 15 and 40 years old, but from 40 to 65, more or less, it's more concerning NCDs, and that's why usually we link alcohol consumption to the non-communicable diseases agenda. Later, then, it becomes a driving of heart cardiovascular diseases after 65. So what we are saying that is that consumption of alcohol produces harm. This harm, of course, can be is a toll of 2.6 million deaths per year in 2019. That's equivalent to 4.7 of all deaths. We also know that this affects more men, and this is because they tend to drink more than women, and therefore the alcohol-related harm is also higher for men than women. But we also know, if we are looking from the lens of equity, and is that young people are drinking, are targeted more from a marketing perspective, and that's a socioeconomic status is also indirectly, disproportionately affecting the harm caused by alcohol consumption. We also know that the harm is more than health. However, this is a slide that shows the trend. In orange, you will see a bold orange is the Americas region. You see that more or less there is some stable trend over time in the last 20 years, and at the global level there is a slightly increase, and that is mostly due to the younger generations. So that translates into 7.5 liters per year of pure alcohol for those over 15 years old in the Americas, compared to 5.5 at the global level. And the burden on the different diseases is in here, but to summarize on the right side of this slide is that 60% of these diseases are linked to non-communicable diseases. So in the sub-region of the Caribbean sub-regions, you see some of your countries here, and you can see also how this is, in general, many countries are over the 5.5 liters globally. And you see also in terms of the burden, how high it is. We say that it's 4.7 compared, that's prevalence of deaths in 2019, and it's over 4.7% at the global level. And you can see some of your countries here a little bit ago. The good news is that countries have committed already since 2005. Alcohol consumption was declared, or a harmful use of alcohol was declared an issue of concern for public health. In 2010, we had a global strategy. It was adopted as a plan of action with, of course, regional adaptations in 2011, and then several of commitments. On the upper side, you see the global commitments, and in the below part of this slide, you can see what has been done at some of the regional initiatives. Particularly important maybe is this SEED, the Small Island initiative that in 2023 had this high-level meeting where many of the issues related to alcohol and NCDs in general and mental health were put forward. You have some notes also there in order to reconnect. But in 2013 already, as you can see here, there were already some global targets and voluntary targets. 9 voluntary targets, 6 of them were related to risk factors, including alcohol. And then there were some targets also in 2015 with the Sustainable Development Goal. And of importance here is the alcohol per capita consumption that you see that we saw still too high and with not real modifications in the global trends. And finally, in 2022, the countries agreed to have also targets by 2030 regarding when they approved the Global Alcohol Action Plan. And here you have some of of this. Lately, there has been an assessment done by the colleagues in PAHO regarding the Caribbean countries, but also United States and Canada. This is done in all the regions or sub-regions, but particularly of interest for you is this one, where you can see that as a modifier risk factors, the progress done overall in terms of the risk of the assessment is very low. And you can see 25% of countries with limited or no progress and 56 with deterioration of the situation. If you look in details, you can see that here you can see the different countries, which doesn't matter to go into the details now, but most importantly, you see advertising restrictions. It's red across most of the countries, and therefore the reason of this webinar calling your attention on this. The other good news is that we have a technical package, and this is an integrated 5 strategies or interventions or policy measures that allow you to tackle the root cause of alcohol consumption. And you see availability, drink driving countermeasures, but also brief interventions, increases of prices, and finally the enforce of bans or comprehensive restrictions on advertising, sponsorship, and promotion. And you can see, you can go through all of these details. I will not go into the details now for reason of timing, but importantly for you is that you have the resources. And finally, this is the implementation goes through across different sectors, and we have also some elements. I give you also some links to PAHO Virtual Campus that you know is accessible and for free. You can enroll, and there is a safer initiative, cost-effective policies to reduce alcohol problems, and you have more details on this. Thank you so much, and apologies if I went over time. I cannot see the chron here. Thank you.
Thank you, Dr. Tello. You did not go over time. Excellent presentation, extremely informative. Thank you. And we'll get to questions at the end of the presentations. I wanted to take this opportunity to remind everyone that we have the chat function. We want to hear from you. Please drop comments, insights, observations, engage with our panelists through the chat function. And you can also use the Q&A function to ask any questions you may have. So Juan, I was really struck by that data point. Around 56% or 9 of our CARICOM countries are experiencing a deterioration in heavy drinking. And that brings us to our next presenter. As we zoom into the Caribbean and think about the issues that we have here, I'd like to invite Professor Rohan Maharaj, who is our alcohol policy advisor, and he's going to share a Caribbean perspective on this issue. Rohan, we can see your slides coming up. Great, just need to go to presentation mode. Perfect, and I'll let you know if we can hear your audio in a minute once you...
Can you hear me?
Perfect. Over
Excellent.
to you.
Good morning, everyone. Thank you so much for joining us, and thank you to the Healthy Caribbean team for once again coming together to have this presentation, which we do annually. I thank you also for all of you around the Caribbean for joining us. And I've put up my email address here simply because I want to take the opportunity if you guys want to reach out to us for any of the things that we're highlighting today, any of the messages, the images, and so on. I think it's important for us to take this opportunity to, when we get together, even if it's once or twice a year, to sort of share these opportunities, both as a learning experience and to understand a little bit of some of the challenges we face within the region. Let's see. Right. I'm going to be talking a little bit about how the alcohol industry has been working within the region, and some of the things that we've been seeing, and have been writing about and have been reporting. And then again, reinforcing what Dr. Tello had just spoken about, the status of the implementation of alcohol policy in the region. We look a little bit closer about what's been happening and give you some examples of things that we would like to see us moving forward towards with time. So one of the things that we have to understand is that the alcohol industry within the region has developed a fair amount of political clout. They're very closely attached to many of our political parties. And there's been development of the CARICOM private sector organization that works within CARICOM at a very high level. And we suspect, even though we don't have all the information, we'll have opportunities for vetoing many of the policies, for example, around health, chronic diseases, even some of the packaging and labeling and so on. So the organizations and the alcohol industry strongly influenced the chair of the Trinidad and Tobago Beverage Alliance, which is an alcohol industry civil society trying to become a civil society. The president of that organization is the chair of the CPSO within CARICOM, right? And this membership of this organization was designed to operate within the CARICOM space and having many levels of enterprise within the organization, right? And there's a fair amount of lobbying that's been recognized in Jamaica. When the government tried to introduce a special consumption tax, the chairman of Red Stripe warned that this would be counterproductive and would lead to the whole idea of reduced treasury for the revenue for the treasury. So the organizations within the alcohol industry are putting this sort of challenge to the governments that you're going to get less income. The challenge that we've had within our region is that we have not been able to get the kind of economic analyses that will tell us what is the cost of alcohol towards our societies. The economic analysis that's been run in other developing countries, such as Thailand and South Africa, for example, very extensive reviews of the economic costs of alcohol, shows that there's a far greater expenditure by government in terms of healthcare, in terms of crime, in terms of accidents, in terms of social issues, which is attributable to alcohol compared to the income that governments get. So this is one of the challenges. We have not been able to do the kind of economic analyses regionally that will help us to have this kind of information. It's useful to know that when the Framework Convention on Tobacco Control became really very critical, and governments started to recognize that the economic costs of tobacco far outweighed any of the financial benefits that they would get in terms of taxes and even employment within the countries. And yet still we see some of our companies here are not talking about that aspect of it. And we need now, as people within civil society, start to think about how can we get this information, right? So part of it is this very strong presence at the level of the governments and so on, but also within Trinidad, we see a lot of the advertisements, and I've taken this primarily from the Trinidad news, where I am exposed almost on a daily basis, is this idea of creating a culture. We have the Angostura Foundation, we have scholarships programs, and for the occasion of CARICOM's 50th anniversary, Angostura created a special rum for them. So this is this whole idea of it's we thing, it's Caribbean culture, and it's actually spelled out in this advertisement, your culture. And so it's not, whereas the other times it's subtle, we're actually telling you this is who you are. right? And for me, one of the other things that we're seeing now is this whole idea of creating brand loyalty. So you might ask yourself, why do you need to create a 0% beer? You know, who is that really targeting? And when you see the bottle down the lower left side there, it's that green bottle with the red star. The green bottle and the red star, sometimes you see that on the football screens. They don't even have the brand name, but you know automatically who this is. So there's this iconic link now. So this young person would buy the zero beer, and then when the next time when they become of age, what's the first thing that's they're going to be attracted to? The colors and the stars and so on that they know, right? And during COVID, we saw the focus of the alcohol industry on the youth, providing computers and so on, of course, branded computers, right? And targeting young people during COVID using a lot of their very attractive and popular singers and entertainers within the region, right? And one of the things that really led us towards having this particular focus, even though we sort of touched this a few years ago, was this sort of mispresentation of how alcohol and breast cancer is linked. And we had this couple examples coming out in Jamaica and in Barbados about how the alcohol industry is promoting mammograms and so on, but with the whole idea of linked to alcohol sales. So we think that this is a mispresentation of information that we know to be very harmful. The alcohol industry also goes out and creates special occasions. So you see International Beer Day Festival, and there's several organizations across the region that you see examples of how they create these special occasions, and then, of course, an opportunity to sell alcohol. And you'll see as you go through that each one of these are different months. So one is February, one is August, one was March. So for every month, there's a different occasion. And so this is, again, how they create this special marketing. We don't have a large Irish population in the Caribbean yet. Still, we see St. Patrick's Day being advertised. Again, this sort of special occasion also. Someone mentioned Carib Girls in the chat at the beginning, and we are bombarded by these kinds of images online and on the billboards around the roads in Trinidad also. And when you're reading the newspaper, some of the very fancy organizations, when I saw this page, I didn't even look at all the senseless killings and Wild West mentalities. I got caught up within the colors on this black and white page. So using a very attractive advertisements and so on. During COVID, we saw a lot of the social responsibility marketing, building goodwill. And it was very interesting, even within the medical fraternity, when I brought this to attention of our colleagues and so on. Many people continue to say, aren't our economies stronger, forgetting all of the economic hardship that fall on families and communities from the overuse and misuse of alcohol. There's been one interesting publication which is available online that you might find useful, and this is a documentation by the alcohol industry's commercial and political activities within the English-speaking Caribbean. And the examples from the Caribbean include the social marketing. I think we're going to have a little presentation on social marketing and digital marketing. We talked about these festivals and other drinking occasions, and we gave the example of the lobbying that is going on in the background. One of the big mechanisms by which the alcohol industry works is trying to change the discussion using trying to go from any sort of formal legislation towards self-regulation and voluntary codes. So you can read through this when you have an opportunity. We'll make these presentations available to you. You see, they tend to say, well, okay, when you do it, it's not such a good thing, but we're going to do it before, right? And so that the SAPRO chairman in the TBAA, which is the Trinidad and Tobago Beverage Alliance, they're saying that they have a strong regulatory framework to set out rules of conduct and engagement. So they're saying, we don't want you, the government, we don't want civil society to do this. We're going to do it for you. And of course, there are always breaches within these these that come out, and afterwards they say that this was being done by someone who's not listening to the legislation or the recommendations that we are recommending to you. Right? The alcohol industry can also compromise effective policies to reduce the harm and create weaker legislation. So this was an opportunity when the then Minister of Health was talking about advertisements during primetime television. The advertising agencies talked about how this is important for the economy of the country and the amount of tax that the government gets. And then after the negotiation with the alcohol industry, what they found is that after working together, the new regulations only stipulate that advertising must include responsible and cautionary measures. And so that the actual final measures were significantly watered down. So we see these things happening. And I think that for us as a civil societies, we need to start thinking, how do we interact with this new information? How do we respond? How do we start a dialogue? And that, unfortunately, hasn't been happening to the sort of extent that we would like. In terms of across the region, what's been happening, there have been several reports that we need to have alcohol policies. And these are 3 newspaper articles from Trinidad, Guyana, and Jamaica talking about the need for it. Sometimes even mentioning that they're going to start on an alcohol policy. But as Juan pointed out before, this is not the case, right? And this is Antigua, Bahamas, Barbados, and so on across the top. And the first one is a written national policy. We see Bahamas being reported as having a written national policy, but when I speak to my colleagues in Bahamas, they tell me, really, we don't know about this. Guyana, Jamaica, and Trinidad and Tobago, I have seen the draft policies, but they have not gone to the legislature. They haven't been put out for public comment. So we're really sort of in a limbo in all 3 of these countries for these sort of policies. If we have policies and we can hold governments to some sort of checklist in terms of how are they proceeding, but that hasn't happened, right? And this was coming out of the regional report on alcohol from PAHO, and what we see is there's no restriction for alcohol marketing for beer in the English-speaking Caribbean. In St. Lucia and in Trinidad, there is some voluntary restrictions and so on, and a partial ban in Jamaica. I, however, in a brief search this morning, can find no evidence of what that ban is. I suspect it basically just says that alcohol cannot be advertised during prime time on television and so on. But if anyone has access to what that ban actually says and how it was enforced, it would be nice if you can share that with us. Right? So what can we do? And I know this is probably going to come up in the discussion. I've put up a few things for us. I think that we need to keep the discussion going. Any opportunity we have to talk to our family, educate our family, especially given the kind of information that we got from Dr. Tello. You know, we only have card 1 day a year, and so we can't really expect a huge amount of groundswell of movement to occur. So this is an opportunity for us to start thinking about working along that way. At a personal level, you might want to practice maybe having a dry December or a dry February, depending on when your Carnival and Christmas activities are. We'd like you to think about distributing the resources created by the Healthy Caribbean Coalition. We have 9 sets of cards over the years. You can use these and share this information within your organization. And we have the proceedings of our conference of last year will become available shortly, and you can look out for that from our Healthy Caribbean team. So in conclusion, the alcohol industry is actively present in the region using political clout, promoting the idea that alcohol is good for economies, creating brand loyalty, invoking culture, having a huge focus on our youth and women within the society, creating these special occasions and appropriating other cultures, and talking about corporate social responsibility. So thank you. I think I'm 5 seconds before I finish. Thank you very much for listening. I hope you found this useful. And the next time you see an advertisement, ask yourself, how is this working? What are they trying to say? And how can we fight back against this? Thank you very much for your attention.
Thank you, Professor Maharaj. Excellent presentation. I'm sure that we're going to have lots of questions, which we'll get to in the Q&A. And now we're going to zoom back out to global perspective and invite Elizabeth to share with us the global perspective around the types of marketing we're seeing globally, and also the recommendations at the level of WHO and some examples of best practice in marketing regulation. So over to you, Elizabeth Ruiz-Cayo. She is the consultant in the Public Health Law and Policies Unit in the Health Promotion Department at the WHO. Thank you, Elizabeth.
Thank you very much, Maisha. Thank you very much for the invitation, and good morning, everyone. Today, I will be speaking about approaches to restricting alcohol marketing. So just as a very brief recap, because we just had a very extensive presentation already on this, but just to underline again that alcohol marketing goes well beyond the advertising of alcoholic beverages in broadcast media or in the press to cover many other practices and activities, including sponsorship of major worldwide events such as the Football World Cup, or price promotions such as buy one, get one free, or happy hours. It also covers product placement, not only in films or in TV series, but also increasingly in online games that are targeted to kids and to children. Of course, it was also mentioned before, alcohol marketing also covers digital marketing, marketing of alcoholic beverages in social media, in search engines, and specific techniques such as influencer marketing. So all of those will be covered by what we call alcohol marketing. And as Juan was explaining earlier, there have been several policies and commitments on alcohol and alcohol policies at WHO. And if we look at them, we see that all of them mention alcohol marketing. And the main recommendation here is to enact and enforce comprehensive bans or restrictions on exposure to alcohol marketing across multiple types of media. So WHO recommends comprehensive bans over partial restrictions as a way to effectively reduce exposure to marketing and to limit the ability of manufacturers and advertisers to switch from product categories and media that are restricted to other product categories or media that may not be subject to restrictions. However, in practice, we see two main approaches that countries follow around the world. On the one hand, we have those countries that have partial marketing restrictions, which means that they will restrict alcohol marketing only for some product categories, for example, for spirits, but not for wine and beer. Only for some marketing activities, for example, for advertising, but not for promotion and sponsorship. Or they will restrict only alcohol marketing to children, but not to the general population. And then we also have content, time, and placement restrictions. And then, on the other hand, we have countries that have adopted comprehensive alcohol marketing bans, which apply to all marketing activities, all product categories, all media. It covers both direct and indirect marketing, and they apply every day and all the time. There's many countries around the world that have comprehensive alcohol marketing bans, but just to name a few that we'll use as examples during this presentation, we could mention Norway, Lithuania, Turkey, Nepal, or Sri Lanka. And if you look at those countries, you see that all of them have incorporated this alcohol marketing ban within a legal instrument, an alcohol act, an alcohol law, some sort of regulations, always a legally binding instrument. So let's look at how they have incorporated these bans and how they have implemented those provisions. If we take Sri Lanka as an example, the first thing we notice when we look at their National Authority on Tobacco and Alcohol Act is that the marketing ban explicitly mentions that it prohibits not only alcohol advertising, but also sponsorship in the second paragraph and promotions in the third paragraph. So it explicitly mentions which marketing activities are covered by the ban so that it does not aim at having broader interpretation or some misunderstanding as to which activities are covered and which ones are not. Moreover, this provision also defines what an alcohol advertisement is. And by giving this definition, it explicitly covers both direct and indirect marketing. If you look on the left, you see that alcohol advertisement is not only the promotion of an alcoholic product, but also the promotion of the drinking of alcohol in general, or an alcohol trademark or brand name, even if no product is actually being advertised. The definition of alcohol advertisement also, although I haven't copy-pasted entirely, also mentions the media that are covered by the ban. And in doing so, they include not only offline media, but also online media, therefore also covering digital marketing. Lastly, what we see in this provision is that Sri Lanka has, as a general rule, a comprehensive marketing ban, but then it includes a list of exceptions, some practices that are still allowed despite the ban. And this is something that we also find in other laws, such as the one in Norway or the one in Lithuania. And typically, these exceptions aim at allowing manufacturers or advertisers to provide descriptive information about the product and their prices to other actors in the supply chain or at the point of sale or in the packaging of the product. But sometimes, such as in Sri Lanka, but also in Norway, the list of exceptions also include advertising in foreign printed media and in foreign broadcast media, which reflects the difficulties that countries may face at enforcing their marketing bans against cross-border marketing. And this leads to the second part of this presentation on some of the challenges that countries face, even where they have a comprehensive alcohol marketing ban. So even with these full bans, countries are currently facing many challenges at translating those comprehensive restrictions to digital environments. This is often due to the fact that digital marketing has some techniques that are very specific, such as user engagement, influencer marketing, or targeted advertising. And this may not be well reflected in those comprehensive bans as they currently stand, and therefore they may be more difficult to interpret by responsible authorities. In countries that do not have a full ban, that only have partial restrictions of alcohol marketing to children, those partial restrictions will also be very difficult to apply in digital environments due to the difficulty of recognizing children online, etc. And then in all cases, countries find it often difficult to monitor and enforce digital marketing restrictions. So as a response to these challenges, WHO published last year a report on restricting digital marketing that you can access through this QR code, where we provide some policy options for member states to adapt their existing marketing restrictions to digital environments and better monitor and enforce current laws. Once a marketing ban or restriction has been adopted, we still need to ensure its continuity, sustain it over time. And here, civil society organizations have a big role to play. If we look at Norway Alcohol Act, which was adopted in 1975 with a full marketing ban, we see that over time, there's been different policy developments, some of which have resulted in a strengthening of restrictions, whereas others have led to some liberalization of restrictions. So it is very important to follow these policy developments, monitor implementation, manage industry interference, which will always attempt to liberalize restrictions, and also to collect pre and post implementation evidence showing the impact that the marketing restriction has had on sales and consumption, because this will be very important for future policy developments and also in the case of litigation. It is also important that once a marketing restriction or ban has been adopted, that it is properly enforced and that we can ensure compliance. And we see that this is sometimes challenging. For example, I mentioned earlier the case of Sri Lanka, which has a comprehensive alcohol marketing ban. However, if we then look at Meta's Transparency Center, which is a website where Meta provides a list of countries where alcohol advertising is prohibited and those where it is restricted, we see that Sri Lanka is not included in the list of countries where alcohol advertising is prohibited, but only those where it is restricted. So it may also be useful for governments and for civil society to engage with online platforms and other advertising publishers to ensure that they are aware of existing restrictions and that they comply with the law. In a similar case, in Nepal, which also has a comprehensive alcohol advertising ban, we observed that this ban was actually not complied with, and alcohol advertising was very much present both online and offline. And in this case, a civil society organization brought a claim before the Supreme Court to enforce the ban, which resulted in the Supreme Court publishing an interim order requesting all alcohol advertising to be removed. So we can see that there is also a role to play through litigation to ensure the enforcement of the law. So these are just some aspects of how to regulate marketing and then how to sustain it over time. But I'm now happy to having a discussion with all of you and answering any questions. Thank you very much.
Thank you, Elizabeth. And I would like to invite Juan and Rohan to turn your cameras on for a Q&A session. I don't see any questions in the chat right now. I don't know if anyone can point me to some questions if there are any, but I do have some questions. I was thinking about Rohan's presentation and his reflection on the kind of industry interference, the interference that we're seeing with the alcohol industry in participating in policymaking spaces. And I wanted to turn to you, Juan, to ask you what the WHO has done, if anything, to help member states to navigate this really challenging area of powerful corporate interests being involved in policymaking spaces.
Thank you very much, Maisha, for this question. It is indeed an issue also for WHO that has conflicted interest, maybe working with some partners where they are sponsoring alcohol or low alcohol, etc. So there is a continuous discussion also in our organization how we corporately deal with this conflict of interest, which are really going into the nitty-gritty, and sometimes we really cannot anticipate. So the work that we have done, there is a guidance that we develop, and I shared that in the slides, so the audience will have access to it in terms in general to look at a conflict of interest and what could be areas of where we can see that happening. We also had discussed, and there is now the possibility to pilot a tool that we have developed in order to work at national level across the different sectors, and how different sectors involved in alcohol policies or in the interest of alcohol control, then could address or could make explicit a discussion around a potential conflict of interest or vested interest. There are countries that have moved already forward, and we put when countries approach us for support, we put them in contact, or we share some of the documents that have been already developed in order to get the best practice. These, of course, are countries, have tools from different countries, but then they need to be tailored to the national context. So those are some of the issues. I'm happy to also to share the tools that are some questions and as guiding questions, and we will be publishing them early next year as well.
Thanks, Juan. I appreciate that. And I think that issue around providing tools to help member states and other actors indeed to navigate this space of conflict of interest is very important. We had a question in the chat in the Q&A function about HCC and how we would approach funding from the alcohol sector. And we responded indicating that we do have an internal conflict of interest policy, which prevents us from working with actors or industries that contribute to NCDs. And alcohol is one of them. I wanted to turn back to Rohan to ask you about, and I'm not sure if you touched on this in your presentation, Rohan, but a very specific example, although we've done very across the region, we've seen from both your presentation and Juan that, there's a lot of red. There are some glimmers of hope. And in 2021, in the middle of the pandemic, the Minister of Health in Jamaica announced an internal policy. And I wonder if you could share a bit about that with us today.
So we've been reaching out across the region, trying to understand where we are in terms of these policies. And as we saw both in Guyana, Trinidad, and Jamaica, these policies have been drafted. However, we haven't seen the government moving it into a sort of a local debate in terms of either taking it for Parliament for discussion and so on, or opening it for public discussion. So that's been a real challenge to us. And while this is so we don't know, for example, to what extent the alcohol industry is having an influence on delaying this. I mean, some of these things are almost a decade old. And that's one of the challenges. Some of these things are happening behind closed doors, and those of us in civil society, when we ask, we're not hearing about it. We're hearing little rumors of things and so on, but nothing concrete. And so we always have to be on the lookout. And that's why it's so important for us in civil society to keep trying to plug away, trying to get answers, trying to work on it, trying to change, to make the awareness occur. Because you look at the media, there's very little discussion happening within our media, within our academia. I mean, look, very few people are actually doing any sort of work trying to describe the problems across your region. And so there's this limitation in terms of when we have CARD once a year, what kind of influence and impact are we going to have? We need to think seriously if we're really thinking this is important work and trying to find some other mechanisms to disseminate the information. So I see we have 86 participants. It'd be nice if we can use this little groundswell of interest that comes around in some sort of mechanism for us to at least get our institutions thinking about this. We've seen, this tertiary education, for example, being infiltrated with all sorts of things about getting safe drinking. But about a third of our students within the university systems are binge drinking, along with vaping and using other drugs. So we need to you can't have safety within that kind of setting. You have to really need to educate our population. And so I feel sometimes our institutions need a bit of support and so on. And just being exposed to it, because again, there's an issue about if organizations come in with money, how can our tertiary education institutions, which struggle sometimes for funds, how can they say no when these people are coming in with really big pockets? So we have some real challenges.
Absolutely. And I think that's part of the reason we were so excited with that announcement from the Ministry of Health. And I had a chat recently with the NCD Focal Point confirming that the ministry still no longer works with the alcohol industry. And there was pushback. And that brings me to a question for Elizabeth. Oftentimes with these restrictions, we start to see the alcohol industry really kind of gearing up with arguments, particularly legal arguments against these types of restrictions. What are the arguments that you're seeing globally in opposition to this type of regulation?
Thank you for the question. I think this is very important because one of the reasons why some countries are hesitant sometimes to adopt new restrictions or laws containing marketing restrictions is this threat of litigation and the possibility that this law will be challenged before domestic or international courts. And very often they will come with human rights arguments. The most frequent one is that their freedom of expression has been violated, or sometimes that their freedom to conduct a business or the right to trade or to commerce is being limited. However, previous litigation shows, especially in the tobacco sector, but even in the alcohol sector, we see consistent litigation, consistent case law, showing that marketing restrictions are usually considered lawful, both by domestic and by international courts. That restrictions to the freedom of expression, for example, can be accepted if they are justified, if they pursue a legitimate interest such as public health, and if they are reasonable or proportionate, and this test will vary a little bit from one legal system to the other. But in general, these marketing restrictions have always been considered lawful. Same thing with arguments that refer to trade agreements, for example. Sometimes the industry will also raise that these restrictions are contrary to WTO agreements or to bilateral free trade and investment agreements that a country may have with other countries. But again, here, previous litigation shows that marketing restrictions are, again, considered lawful. And so the threat of litigation is often stronger than the actual outcome that litigation would have, and also the pressure that it would require in terms of time, of human input that would be required, and therefore of also financial burden that this would have in legal costs and time dedicated to the claim, let's say. But the outcome itself of the litigation is often in favor of governments.
Thank you, Elizabeth. And we're going to have to wrap up the session, but your answer really resonated with me in the sense that, there's this kind of constant refrain, this industry playbook. And the arguments that we hear in alcohol are the same arguments we hear in tobacco and very much in food. So there, again, speaking to the Rohan's point about broader civil society mobilization and learning across each of these kind of unhealthy commodity actors. So we're going to wrap up the session, but don't worry, our experts are still going to be online if we have any questions, if they arise over the course of the next session. Thank you again to Dr. Tello, to Elizabeth, to Rohan. Thank you so much for your informative presentations. And now we're going to move to our civil society portion of the webinar. And we're going to hear from global civil society organization Movendi. We're also going to hear from young people and civil society leaders across the region. We're going to kick off this session with a presentation from Movendi. And the presenter is Ms. Angelico Claro. And she is the civil society coordinator at Movendi. And we're delighted that Movendi can be with us. Movendi is the global alcohol advocacy organization that has been doing powerful work in this area for quite a long time. So we can see you and I think we can hear you, Angelica. Over to you.
And I hope you can see my slides now also.
Yes, we can see your slides.
Perfect. So thank you and good morning, everyone. It's my first time here, so I'm truly honored to be here today as part of the Caribbean Alcohol Reduction Day celebrations. And it is actually inspiring to see such a dedicated group of individuals. I just noticed that we even have a dentist today in the audience, and all of us are coming together to tackle one of the most pervasive challenges of our time, and that is alcohol marketing. And today I was invited to share how we at Movendi International are working together with partners around the world to protect populations from alcohol marketing through policy solutions. And I know we have seen this today during other great presentations. Elizabeth, she gave us really good insights, but let me share this foundational understanding. Alcohol marketing is a tool that big alcohol has. It is something that industry uses to condition psychological associations, perceptions, expectations, and behaviors with their products. And these strategies go beyond selling a product. The alcohol industry is teaching people how to use alcohol for identity creation and how to feel when using alcohol. And this is not accidental. It is an intentional, systematic effort to normalize alcohol harm, and make people feel unfamiliar, uneasy, or even confused when someone prefers not to consume alcohol. So the normalization of alcohol marketing creates environments where it's almost impossible to escape its influence, particularly for young people and vulnerable populations. So this highlights the urgent need for us to challenge these strategies and implement safeguards. And as a global social movement dedicated to development through alcohol prevention, our role is to support civil society organizations in their efforts to implement effective policy solutions to the problems caused by the alcohol industry's products and practices. And let me share some examples of how we are working with our partners around the world. And these examples are from this year, and they illustrate the diverse forms of support we provide, tailored to the unique needs and contexts of each region. So let's start with Ghana. In Ghana, we worked alongside our member organization by providing them with evidence and to protect the ban on celebrities promoting alcohol. This ban was under threat, but with our collaboration with them, they successfully defended it. And this victory highlights the power of evidence-based advocacy in countering industry influence. Now, moving to Czechia, Our role there has been to provide technical knowledge to our member organization as they work to include alcohol marketing restrictions in a broader effort to improve their country's alcohol policy. And this includes helping them design specific regulations in line with international standards. While this work is still in progress, it represents an important step toward aligning such as alcohol policy with evidence-based global best practices. Now let's move to Estonia. In Estonia, we have supported a youth member organization in defending the country's comprehensive alcohol marketing regulations. They had to defend this on television in a show with a journalist, and we provided support in framing their arguments effectively. Additionally, we enhanced youth advocacy efforts, ensuring their voices were central to the conversation. And here is another example regarding the Western Pacific region. Together with the WHO Western Pacific Regional Office, we've worked on documenting and exposing young people's exposure to alcohol marketing in 5 countries: Cambodia, Laos, Mongolia, the Philippines, and Vietnam. And this collaboration involved developing a training course, a smartphone app to report, and writing a detailed report based on the findings. Once the report is launched, we'll set up advocacy support to amplify the results and push for stronger protections against alcohol marketing across the region. So these examples demonstrate that change is not only possible, but already happening. And to continue making progress, we must work together to strengthen our understanding of this evidence, monitor, document, and expose harmful marketing practices, and actively engage in advocacy efforts. So let me share one last example from a youth-led campaign 6 years ago. This powerful initiative serves as a reminder of how innovative approaches can effectively challenge the normalization of alcohol marketing. In this campaign, what they did, they used a creative and thought-provoking approach to demonstrate just how normalized alcohol advertising has become in our daily lives. They replaced images of alcohol in advertisement with mangoes. And they did this meaningful question. It was a simple but yet powerful question. How many mangoes do you see in your feed? And the call to action of this campaign was to encourage the public to support young people's desire to stop being exposed to alcohol advertising on social media. So for me, this reminds me that young people have a unique ability to innovate and lead change when given the tools and platforms to do so. So as we celebrate Caribbean Alcohol Reduction Day, I just want to leave you with a message of hope and determination. It is possible to protect populations from the harmful practices of alcohol marketing. And if you'd like to learn more or connect with us at Movendi International, please don't hesitate to reach out, and let's keep working toward a world free from the harms of alcohol marketing. Thank you.
Thank you, Angelica, for a really interesting presentation. I thought that example of a social media activity targeting youth was so innovative, and so lots to learn from us in the region from what you're doing at Movendi. I'd like to now invite Carissa Moss. She is she's also a member of HCY, but she's the other card consultant who worked with us this year. Carissa is going to share with you some work that they've been doing in preparation for card this year. Really excited to see what they have to share. So over to you, Carissa. We can see your slides. Perfect.
Thank you for that confirmation. Good morning, good afternoon, good evening, everyone. Thank you, Maisha, for the introduction. It is a privilege to speak with you all today. So as mentioned, my colleague Simone and I have had the wonderful opportunity to examine how unrestricted alcohol marketing in the Caribbean influences various audiences, particularly young people and women. And as we've been learning, these groups are strategically targeted by the alcohol industry as key growth sectors. And so today we aim to continue to demonstrate some of these tactics and share insights from what we found. So in my experience, I grew up in the Bahamas. Alcohol advertisements have been plastered everywhere, and that seemed normal to me. And that may be the same for your environment as well. However, understanding the lack of marketing restrictions and the industry's strategies have now helped me to become more aware of this. So I hope that our discussion today will do the same for you and inspire action to advocate for stronger marketing regulations that protect our health. And so to begin, we want to hear your thoughts similar to earlier. So we're going to use the same Mentimeter as well. On an example of alcohol marketing for young people. So here's the ad. I would like you to just briefly study this. Okay. And then I would like you to join our Mentimeter by either scanning the QR code or entering the code at menti.com. So after viewing the image that I just showed you, tell us what stands out to you. What does this image depict to you? So I'll show the image again. And then I'd love to hear some of your feedback. Okay, great. So we see fun, young people having fun, but alcohol's at the center of it. I'm sorry about that. Going back to my slide. Sorry about that. 1 second. Great. So these responses are great. Fun, drinks, youth, fun and friendship, young, attractive people having fun, pure joy dependent on alcohol, friendship, togetherness, fun, closeness, men and women being equal, alcohol dependent fun, drink and live. So all of these are exactly some of the ways that the alcohol industry uses these marketing strategies to target individuals and make you feel like alcohol can help you do all of these things. So our review that we've done highlights several trends that's used in alcohol marketing across the Caribbean, and we'll walk you through some of the most prominent ones. And so we've been noticing that a lot of alcohol ads often portray young people in vibrant social settings, similar to what you mentioned earlier, especially during cultural events like carnivals. These ads normalize and promote alcohol consumption among this group, and suggest that alcohol is a part of celebration and fun activities. So the use of bright colors, catchy slogans, popular music, and even cartoons, they all appeal to youth. And corporate partnerships with universities have also been occurring recently to promote the concept of drinking responsibly among vulnerable youth in the region. In sports, the industry's involvement, it seems charitable, providing sponsorships and donations to youth teams, yet this creates a harmful contradiction, as we've been talking about, as alcohol consumption is dangerous to young people and undermines the health and discipline that's required in athletics. Alcohol marketing is also heavily ingrained in Caribbean culture. We've been seeing in some Caribbean countries ads near schools, hospitals, beaches, parks, and around playgrounds, carnival grounds. And so the lack of restrictions allows these ads to saturate environments where children and young people are most vulnerable or where they frequently socialize. And so these screenshots here were all taken from public areas in a certain Caribbean country that's known for being near some of these schools and public parks where minors frequent. Women are increasingly central to alcohol marketing, and ads frequently depict women enjoying alcohol and often include popular Caribbean social media female influencers also being a part of alcohol marketing as well. That's been an increase or a trend that's increasing that we've been seeing. And disturbingly, as mentioned earlier, there's also a trend of sexualizing women in these advertisements, and this also reinforces some of the harmful stereotypes that we've been seeing. Additionally, alcohol companies have co-opted causes like breast cancer awareness, So campaigns such as Drink Pink or Pink Friday happy hours, they misleadingly frame alcohol consumption as supporting breast cancer prevention, despite alcohol being linked to increased breast cancer risk. Alcohol companies often collaborate with civil society organizations for events like Breast Cancer Awareness Month, as mentioned before, or even cardiovascular disease fundraisers. And while these partnerships may seem charitable, they pose a conflict of interest and ultimately normalize the presence of alcohol in health-focused spaces, which only ends up perpetuating harm. And so as you can see on some of these graphics, there's feedback about $1 will be donated to, and then it would be a specific health-focused society. And so the team at HCC has created an infographic that summarizes these insights and recommendations, which you can share with your colleagues and reflect upon, and the link will be shared in the chat. So this infographic highlights the harmful impact of alcohol marketing, the lack of regulation in the Caribbean, the need for policies that's guided by the WHO Safer Initiative and the Global Alcohol Action Plan 2022-2030, which was referenced earlier. It also speaks to some progress that's been made by countries like Jamaica, where their Minister of Health stated that public health institutions should not associate with or use public health platforms to promote alcohol brands. And we also end with a call to action for collective responsibility. And so in closing, I just like to highlight that call to action. And so we call on CARICOM governments to implement the WHO's Safer Technical Package and the Global Alcohol Action Plan 2022-2030 that I referenced earlier. We also call on them to enforce bans or restrictions on alcohol advertising, especially those that target young people and women. We call on the alcohol industry to cease marketing strategies, especially those geared toward young people and women, especially during Breast Cancer Awareness Month and sporting events. We call on civil society organizations to educate communities about the harm that alcohol causes and to advocate for stronger marketing policies and to be mindful of the collaborations that they may do with alcohol industry. And then we call on all individuals. If you drink, consider drinking less. If you don't drink, don't start, to think before you drink and to share this message with others. Thank you.
Thanks, Carissa. Really informative presentation. Much appreciated. I'm now going to invite our panelists for the discussion to turn on your cameras. But before you do that, I just wanted to introduce them. You've heard from Carissa and Angelica already. And we have Dr. Tamara Remy. She's the president of the St. Lucia Cancer Society, a consultant general surgeon. She's also an HCC board member. We have Dr. Asante LeBlanc. She's the director, the board of directors for the Trinidad and Tobago Cancer Society. And we have Simone Bishop, who you've met already, who is the HCC card consultant. Professor Maharaj will join us again. Folks, we're running a little bit over time, so hopefully you'll hang around because we may go about 5 minutes over. But with that said, let's introduce the panel. Really delighted to have you all here. I'm going to kick off the questions with a question to Dr. Remy. And this is really around basic knowledge and awareness. Do we think the Caribbean people are aware of that data, that note that cancer is caused by alcohol? Do we think that they know that there's no safe level of consumption? Because we keep hearing with our sensitization, people just don't know.
Hi, Maisha. Hi to everybody. Thanks again for having me on the panel. An honor. I don't think that the majority of people in our region, and I can talk about St. Lucia, are even aware of this association between alcohol and cancer. I know that we're aware of, drinking and driving and accidents and maybe liver disease, because we see a lot of patients, at the end stages, but we definitely are not. And I think we have a lot of challenges with that because socially and culturally, we're just not wired to think of not drinking alcohol. And I think as a CSO, and certainly in combination with our governments, there's a lot of work that has to be done. It has not been a priority, I can say, for the CSOs in linking alcohol. We speak about smoking, we speak about so many of the other risk factors. And I think we actually tend to forget about alcohol, especially breast cancer. It certainly is not really listed as one of the more common associations. And I think with the governments, there is a hesitation Because I've seen, especially in our St. Lucian local politics, that is almost a political suicide move to talk about anything that links reducing access to alcohol and increasing taxation. So there's a lot of work to be done.
Thanks, Dr. Remy. We have a comment from the chat from Dr. Hospitalis saying that he agrees with you that he does not think that the vast majority of people know about alcohol causing cancer. So I'm going to ask a similar question to you, Simone, about young people. Do you think young people are aware of the dangers? We've seen the extent of which a lot of this marketing targets young people, including young women. Do you think that they have an awareness around the link between, dangers of alcohol consumption?
So kind of building on Dr. Remy's points because alcohol is just such a deep-rooted part of Caribbean culture, from my perspective, I don't think there's enough public information or public awareness of the consequences of drinking alcohol and its effect on every aspect of life, apart from the usual drink responsibly or don't drink and drive. And if you think about it, I can't remember the last time I saw an anti-alcohol ad, and if I did, was it as powerful or as impactful as, for example, an anti-smoking commercial showing the testimony of a heavy smoker that is unfortunately now fighting lung cancer. And what the alcohol industry has done as well, because there's this growing movement of young people, older persons who are becoming more health conscious, who either want to reduce salt intake, sugar intake, drink less alcohol. We see the provision of no low alcohol beverages, same great taste, less alcohol or no alcohol. So these are just providing options to appeal to the health consciousness while maintaining and bringing in new customers. So while the effects of these products are still under-researched, it just misleads the public to drink more, thinking that these options are better for you, healthier. And finally, since, as we've seen in the examples, alcohol ads push that glorified image of having a good time now, worry about consequences later, especially among young people. So no one's really thinking about the negative effects and that raw messaging and awareness of what could happen to you if you continue, if you overdo it, especially directed to young people and women, needs to be pushed more to see any kind of positive changes in consumption, because, the alcohol industry, as other industries, they'll continue to do what they usually do, sell products and make a profit.
Thanks, Simone. Now going to Dr. LeBlanc, as I was looking at Carissa's presentation, what struck me were the advertisements around breast cancer awareness and also the alignment with NCD, civil society organizations. So as a cancer advocate and physician, what are your thoughts when you see alcohol companies creating partnerships with CSOs or civil society organizations around Breast Cancer Month to promote alcohol consumption amongst women? They're pink drinks. What are your thoughts when you see that?
Morning, everybody. Thanks for having me. The Trinidad and Tobago Cancer Society has taken a stand a few years back where we were definite on such partnerships not being acceptable, just as a conflict of interest. My thoughts on seeing that is that the CSOs have to make a decision. The CSOs, we can't talk a talk and not walk the walk. So it's not acceptable. Plain and simple, it's not acceptable to say drink alcohol, a pink drink during Breast Cancer Awareness Month, and we'll give, and this will somehow help a woman who's dying of cancer. It's not matching. You understand? But saying that, we've all accepted that our culture in the Caribbean is one that accepts alcohol, and we lime in, we having fun. We've seen the ads, we see the ads every day. So I know, just as Tamara said, we have a lot of work to do. But as CSOs, we had so much work to do for all the NCDs. So you had to really eat the cake piece by piece. You understand? So now we've come to the piece that we need to eat. And because, smoking and vaping is a big piece we're still trying to eat. How we eat processed foods. It just coming at us like an avalanche, dare I say. So I don't think it's right. I know it's not right. CSOs have to come together united. We have to walk the walk, and we have to really, because this is not a fad. It's not something that we're choosing to attack because of attacking sake. It's for our health. So we have to educate, and our inroad is to educate the youth. Use education as a tool. Don't give up. Don't give in. And that is our way, because the consumption will decrease if they're educated to not consume it, and to consume less if they are consuming it. And that is then the supply and demand of economics, dare I say. So that's what we have to continue to do.
Thanks, Asante. So sticking with the Cancer Society, is going to just pop back to Dr. Remy because we are over time, and just building on Asante's response around what we can do as civil society organizations to address this, to tackle this. Do you have anything to add to that?
I think we have to stop assuming that even the persons working with us are on the same page, because I would disclose that even when we had our carnival band in 2019, we were getting sponsorship or offers of sponsorship from alcohol companies, from fast food. And I had to actually be reminding board members that even though we're looking for these contributions and sponsorships, we have to stay true to what our mandates are and our vision and mission statements. So I think we have to start internally by getting everybody on the same page. And not assuming that everybody is, and that the thrust for getting funding and sponsorship should never, ever take priority over what our mandate is. That's number one. And advocating, we've done a lot with tobacco smoking, especially in St. Lucia, banning places like cigarette smoking or tobacco smoking in certain places. We've made some serious headway, and just putting those proposals forward to governments and putting some pressure on them. But I think we are responsible. Like you said, Asante, we have so many different things working on. But I think alcohol, and as a general surgeon, we're seeing not necessarily just cancer, but we're seeing all of the effects of alcohol. I mean, any chronic disease that you can think of, you can link it to alcohol.
Thanks, Tamara. Okay, turning to you, Angelica, and wondering if you can share how Movendi has supported global CSOs in managing and countering interactions from the alcohol industry.
I would like to start answering the second part of your question first, because actually counteraction is really important in Movendi International, and we have worked with different partners to do this. I will give you a couple of examples. We have, for example, the Union of the International Cancer Control. And almost a decade ago, we developed an internal brief for their members. And this brief helped them understand science behind the link between alcohol and cancer, and to address the misinformation and the lies the alcohol industry spreads about the carcinogenic effects of their products. And building on this, we've continued to advise other national cancer institutions, organizations on industry interference and policy solutions. And one of them, for example, is cancer warning labels on cancer. So that's one example. Another example, we have a collaboration with the NCD Alliance during the pandemic to expose how big alcohol used crisis washing to exploit the global health crisis. And together with them, we work on their report revealing these tactics and successfully push back against the Global Fund decision to take money from Heineken. So that's another example. We've been working with the Global Alliance of NGOs for Road Safety to address the serious challenge posed by the alcohol industry's involvement in road safety initiatives. And we know big alcohol often uses this policy space to build government relationships and position themselves as good citizens, good corporate citizens. And that we know ultimately undermines public health policy. So we've been supporting the Alliance by identifying conflicts of interest understanding industry's tactics, and helping NGOs eliminate these conflicts to protect public health and road safety initiatives. And we also have developed a website and an app called Big Alcohol Expose. This platform empowers people to join forces in revealing the predatory practices of the alcohol industry. I encourage all of you to share cases from your countries or community, whether it is aggressive lobbying, unethical marketing, or efforts to sabotage rules or institutions. So I'll share the link, or maybe you will help me, Maisha, so you can check it, explore it, and contribute. And regarding the first part of your question, we generally advise against direct interactions with the alcohol industry, as they are often fruitless and harmful. The industry uses these interactions to create a health halo and distract from their predatory practices and products. So we also work with global CSOs to address health harming industry as commercial determinants of health, and empower UN agencies and governments to eliminate these partnerships and reduce interactions. So our Big Alcohol Expose work plays a key role in documenting conflicts of interest and exposing those unethical practices.
Great. Thanks, Angelica. So I'm going to turn to Rohan. And in the interest of time, this is what we're going to do. So we let the panelists know as well as you, the audience. Rohan has some exciting news. He's about to launch a publication. We'd like to hear more about that. And then I'm going to invite the panelists. We had a few more questions, but I'm going to ask them to reflect on kind of a closing point and just think of, 30-second to a minute summary comment, and then we'll wrap up so we don't go too much over time. So Rohan, can you share more with us about your new publication?
Yeah, so thank you very much, Maisha. So what happened last year is we had in our 8th Caribbean Alcohol Reduction Day, we had a conference in Trinidad, and we've put together most of these presentations into a sort of a proceedings of the conference, along with some additional ones, and that's going to be made available free of charge through the HCC webpage at some time in the near future. We're hoping by early January. All we're going to ask is, one of the things that we talked about here and mentioned very briefly is stories. Every single Caribbean person I've ever spoken to has a story about alcohol. And what I'm hoping to do is to collect those stories and create a knowledge base so that we can share those stories with other people around the region, maybe through the HCC webpage. But in order to get the book free, you have to tell me whether or not you'll be willing to participate in the storytelling. Okay, so look out for that. We'll be sending you a QR code, and we should send you to a web page, which will then give you access to the book once you sign off. You don't have to agree to share your stories, but maybe if you're a healthcare professional, you'll be able to pass that information on to other people, so we can get other people involved in the storytelling. Quickly, I looked at the Drink IQ thing. Someone had asked a question, and it looks like it has some really proper information without any sort of commercial issues. So I think I have to look at it a bit more, but my first initial sort of blush at it is that it's proper information that's well presented. And there was one other thing that someone had asked, the H Health Economics Unit. They have done, so this health economic analyses are expensive. And if you think about it, we have 14, 15, depending on how you check it, English-speaking Caribbeans around our countries. If you have to do one for each country, that's going to be an expensive process. Health economic analyses are extremely expensive, resource consuming, and so on. And we haven't had the funding to do these kind of things. Our governments haven't made it a priority. So that's why the Health Economics Unit have done brief analyses on things like taxation and the benefits to governments if we tax alcohol and tobacco and so on. So they have had some work in the past, but I haven't seen any more recent ones looking at alcohol specifically. So I hope that helps. Thank you very much for the opportunity to share this lecture.
Thanks, Rohan. So just before we get to the closing remarks, I wanted to acknowledge some comments in the chat. From James Hospitalis, again, this has needed a very uphill struggle. I've been in many health ministers' meetings and CARICOM heads of government meetings, and they don't really want to touch alcohol. One reason which is misplaced is the fear of losing income. And I think this also points to like this power imbalance that we speak about more broadly when we think about the commercial determinants of health and unhealthy commodities. And it also links very nicely to the comment made by Laura Tucker Longsworth, and that's that we need to do a very strategic job of identifying those health neutral, and health promoting actors within the corporate sector that are willing to fill these gaps, whether we're talking about alcohol or tobacco or ultra processed foods. And when we think about the commercial determinants of health, they're not only negative impacts, there are positive impacts as well. And there are commercial actors who have a really critical role to play and can fill those gaps, especially in our small settings. So thank you for all of you who've been engaged on the chat. We hope we've covered all of the questions. We appreciate the engagement, and we're going to wrap up now, and I'll ask each of the panelists to provide a closing comment. And I'll start with Asante. I saw you smiling there. I didn't know if the juices were flowing and you were ready to go.
Oh my God, I was not. But anyways, we all have the same message. We're all saying the same thing. It's an uphill struggle, priority by the governments, economics, and more economics. And when will we see the truth? So we're all saying the same thing. So, I mean, really and truly, it's continued education, as I stated. When we tackled our smoking and anti-vaping campaign, nobody thought we should do it, and nobody thought it would work. And it's about not giving up, and it's about reaching the youth. The young people today, as I say, they walk out of the uterus now with an iPad in their hand. Long ago, they had a floppy head and they were hitting the bum to scream. So they're much more empowered. So we have to continuously educate them so they make informed decisions. We have to make our leaders more accountable and responsible. And this is not that they haven't been in the past, and we have to also recognize that times have changed. And with that change, we have more research, we have more knowledge, and we should use that and not try to run and hopefully just, say, oh, economics, and they're going. And now I'm a Cuban-born guy, and he's living in Trinidad. Those are 3 countries that produce alcohol. God help me. You know what I mean? So we really need to speak to the industry. Let our leaders take charge, because we can't do it alone. We need our leaders to take charge to effect the policies that they draft in, day out. So we have to continuously send that message out, educate our youth, and not give up at all, honestly.
Thank you, Asante. And let's go to Simone.
Yeah, so kind of building on Asante's point, we see the marketing that's happening, especially targeting young people and vulnerable groups. So these strategies, they are not revolutionary by any means. Similar industries have used it, ultra-processed products, tobacco. But what this is doing is just worsening the already existing pressure and acceptance to consume alcohol, especially among young people, creating environments that promote these health-harming products and ultimately violate the Convention on the Rights of the Child. And to be completely transparent, there's no exception that individual behavior or the Caribbean's relationship with alcohol will change overnight. But especially speaking to the young people on the call, we need to recognize the environment that we're exposed to. And I think be more mindful of the risks to our health, because no one else is going to do that for us. And unfortunately, we need to see it for what it is. We are relied upon, we are exploited to push products that we are still expected to act responsibly or not let it affect us.
Thanks, Simone. I'm going to jump to our colleagues at the global level and invite Juan to provide a closing comment.
Thank you very much. I think this was extremely helpful to understand better the region and for me. But definitely, I can hear a lot of issues that you face that are common to many other civil society organizations across the globe. So that is somehow, it's good that you all also connect. And I know that there are a lot of initiatives to help people to connect in order for you to look at these synergies, how to apply what we learned from tobacco and food to alcohol as well, and to understand this playbook of the industry. From our side, we have had also global meetings with civil society organization, also we will be happy also next year to host another one. So I'll make sure that that you attend and you share with us these important takeaways and your work at the ground level, which is fantastic, and I can see that progressing as well. Most importantly, we do have global tools. We do have commitments from the countries. We need to hold them accountable, and nobody better placed than you for doing so. So thank you so much for this opportunity, and I hope to see you next year.
Thank you, Juan. And over to you, Elizabeth.
Thank you very much. And thank you very much for the invitation again to this workshop. It was very interesting. And I think there's a lot of opportunities for all of you here to do things, to start working on some marketing restrictions. And as Juan was saying, it's very important that to cooperate with other civil society organizations and to reach out also to WHO if you need some support, some assistance, some guidance, or just for us to guide you through all the publications that are available already, but also to organize, as Juan was saying, meetings, webinars, and so on. And I would also advise that you start documenting as well everything that you are seeing, especially in the context of digital marketing. It's quite easy to just scroll online and really take evidence of what exists, because that will be probably a strong entry point with different actors, with governments, and so on, to show the extent of the problem. Thank you.
Thank you. Thank you. And I wanted to highlight, because this is an important one, a comment from Juan about the idea of responsible drinking, and also this idea of harmful consumption of alcohol. And what does that mean against the background of when we say no safe level? So the language needs to change as well. And I'm going to ask Angelica to provide your closing comments, then we'll move to Tamara, and we'll wrap up with Rohan.
Well, actually, I would like to highlight that the evidence is becoming increasingly clear about the harms caused by the alcoholic products, and the practices of the alcohol industry. And at the same time, and we haven't commented this here, we have seen a global trend where actually younger generations are staying alcohol-free much longer. And even the ones that do consume alcohol, they consume much less. So this is really important. We need also to highlight those kind of realities. And also, public is demanding for stronger alcohol policy, and this is growing worldwide. So this is also something we need to keep in mind. And understanding this global picture can help illustrate that regulatory action is the only effective way to address the predatory nature of the alcohol industry. So three final lessons learned that I would like to highlight. First, identify who big alcohol is, what they do, and why they do it. This is foundational understanding for a first shot to vaccine ourselves from the industry interference. Second, monitor and document industry tactics. Not only monitor, but document. That's really important. And supporting CSOs, academia, and policymakers in this effort systematically helps to recognize and resist these strategies from the alcohol industry. And third, and finally, expose and counteract their practices, revealing their harmful strategies and devising proactive countermeasures helps shrink big alcohol's influence and normalize their role in policymaking and society at large. So thank you.
Thank you, Angelica. And over to you, Tamara.
All right, so 30 seconds, right? So I just wanted to say, echoing everything everybody has said, even though this is coming at the end of the year, we should really mark today as the beginning of a new campaign for 2025, focusing and prioritizing alcohol. I think there's a lot of, like we tend to do at the end of most meetings, everybody's energized and ready to go. But I think alcohol, the time has come for alcohol to actually be, one of those that we address. We all recognize the role of the government, the role of our CSOs. I would like to challenge everybody to include policies that avoid conflicts of interest whenever us as CSOs have campaigns, etc., just to make it like a policy among each of us. And I would like us to consider maybe, because we have to address different populations differently. So adults as compared to teenagers, but maybe we could consider a campaign for teenagers and young adults where we're not stressing so much all the bad things about alcohol, the bad things about cigarettes, etc., but focusing on self-love, self-care. So you don't introduce a lot of those things, but you focus on what it means to actually take care of your body. So how you eat properly. And I think that that language will help to eliminate all of the things we've been working at with HCC. So the trans fats, the ultra processed, the sugar, all of those. Once you focus on what you should be eating, and what you should be doing, perhaps looking at it from that angle might be a different way to engage our young people on how to live properly and how to take care of ourselves.
Thanks, Tamara. And before we get closing remarks from our HCC Alcohol Policy Advisor, I wanted to thank everyone, all of the participants, all of our team behind the scenes. Our HCC team is fantastic. Thank you for all the panelists. Thank you, PAHO, for your continued ongoing support. Thanks to Dr. Connell for your leadership. Just wanted to remind everyone that we have a page on our website that is dedicated to CARD, and it has all of the CARD materials for the past few years. You'll see the webinar posted there early next week. The infographic and materials will be available soon. We just have to do a bit of refining. So thanks again to everyone, and I'm going to hand over to Rohan to wrap us up and close us out.
So thank you all for coming. Maisha, it's 9 years since we got together and started this process. We used to have 20 people. Now we have close to 100 coming on. And every year the energy builds. We have more panelists now than ever before. We used to be about 45 minutes. Now we are 1 hour and a half. So my message to us all is every journey begins with the first step. That even though this is a struggle, we're fighting 300 years of alcohol culture within the Caribbean. It's not going to be easy, but at the same time, every step that we've taken with all the wonderful stories and points that we've gotten from all our panelists, if we start applying that, each of us in our little ways, is going to have an impact. We're going to reach what they call a tipping point where our societies will change for the better. In our small island developing states, human resources are probably going to be the next only thing that we're going to have left, and we have to build our human resources. And every step that we take along the lines of combating NCDs and alcohol and sugars and getting our people moving is all an attempt to make sure that our human resources are maximized so we can be the best people that we can be. So thank you all for coming on. Thanks for listening to us, and I hope that you will get our QR code and join us in terms of looking at the next step in terms of creating some stories. You know, the Bible is based on stories. It's changed all of humankind. Let's create our own little alcohol Bible in the Caribbean, even that people may get upset with me saying that. But that's the kind of way we can use those stories to create good. And I hope that you all can join us on that next part of our journey. Thank you very much, everyone.
Thanks, Rohan, for ending on that note, bringing it back to people. And that's why we're all here, right? Changing people's lives. So thank you, everyone, and have a wonderful day. Enjoy your weekend. We're going to close off. Thanks for sticking around.